There are lots of myths about facelift surgery, but if you're asking the right questions, you'll get the truth. I'm Dr. Stile, and I'm a board-certified plastic surgeon, and I've performed numerous facelifts at my surgery center here in Las Vegas. So let's go over the top 10 questions I get from patients about facelift surgery. By the end of this video, you'll have the answers you need to help you make an informed decision. The first question I'm commonly asked is, Dr. Stile, how long does a facelift last? A facelift typically lasts around 10 to 12 years, but that number is not set in stone. Factors like your starting age, skin type, and lifestyle can affect how long your results last. It's important to remember that you must maintain a healthy lifestyle to get the most out of your facelift. And it's also important to remember, a facelift turns the clock back, but the clock keeps ticking. The second question I'm commonly asked is, will I look fake or too pulled? The answer is not at all. When done correctly, a facelift should look completely natural. The goal isn't to stretch the skin, but to lift and tighten the underlying structures of the face. This will restore your youthful appearance without making you look like somebody else. The third question is, well, what's the recovery time for a facelift? Recovery time can vary, but most people are ready to return to work within 10 to 14 days. The fourth question I'm commonly asked is, are there any visible scars after surgery? Incisions are strategically placed in natural skin creases, like around the ears, under the chin, and along the hairline. They're well hidden. While you may have some scarring, it's minimal, and this fades over time. If done correctly, you should be able to wear your hair back or in any hairstyle and have a person standing at a conversational distance without being able to detect any noticeable scars. The fifth question that patients typically ask is, how much does a facelift cost? Facelift prices generally depend on where you live, the surgeon's expertise, and the complexity of the procedure. No two surgeries are the same. Each are custom tailored to each unique patient's needs. Keep in mind that cheaper options may not give you the results you're hoping for, so it's important to prioritize experience over cost. The sixth question, Dr. Stile, how painful is a facelift? Most patients report feeling some discomfort, but their discomfort is usually well managed with minimal pain medication. The discomfort is not unbearable, and once the swelling and bruising subside, you'll be able to enjoy your results. 7. Who is a good candidate for a facelift? Good candidates are typically healthy individuals who have visible signs of aging, like sagging skin, deep wrinkles, or loose tissue. If you're not ready for surgery or have serious health conditions, it may not be the right option for you. We can talk through all of your concerns during an in-person consultation to decide what's best for you. 8. Can I combine a facelift with other procedures? The answer is absolutely. Many of my patients choose to combine facelifts with eyelid surgery, brow lifts, or even non-surgical treatments like fractional CO2 laser skin resurfacing. Combining procedures can help create a more dramatic yet harmonious result. Number 9, how soon will I see my facelift results? Well, you'll start to see improvements immediately. The first day, once your dressings are taken down, you'll see changes, but the results will continue to improve over the course of the next few weeks and will fully mature over the course of 3 to 6 months following your procedure. And finally, number 10, am I too young or too old for a facelift? Well, age is not necessarily a barrier to getting a facelift. Some people may choose to have a facelift in their 30s and 40s as a preventative measure, known as a maintenance lift, to address the early signs of aging. Older patients present with obvious signs of aging, like lax skin, loss of volume, jowling, banding in their neck, etc. Those patients are great candidates for it as long as they're healthy, and the interventions are very straightforward and will be discussed during a consultation. So there you have it. I answered my top 10 questions that I am most frequently asked about patients regarding facelift surgeries. It's all about understanding what the procedure can and can't do, setting realistic expectations, and working with a skilled surgeon. If you're ready to talk about whether or not a facelift is right for you, please schedule a consultation with me at Stile Aesthetics today. I look forward to seeing you. Until we meet in person, be well.